is Jean Swidler. I'm the Executive Director of Genetic ALS and FTD and the Legacy. We are a patient-led organization focused on the needs and the interests of the genetic ALS and FTD community. And we're so excited to have this conversation available for folks today. And with that, I will introduce Lyle Carrera, who works at the National Academies of Science, Engineering, and Medicine, a nonprofit organization chartered by the government, I believe. I think Lyle will confirm all of this, and who helped organize this report that we're speaking about today. So I'll kick it over to you, Lyle, and you can share your screen.
Awesome. Thank you so much. I will share my screen here. Sorry, just give me a sec. And can we all see this?
Yep.
Awesome.
Hi, Lionel. Good seeing you.
It's good seeing you, Rita. Hi, everyone. My name is Lyle Carrera, and I'm a research associate at the National Academies. Over the past year and a half, I helped support this awesome committee of 18 wonderful experts as they put together the consensus study report, Living with ALS. Our committee members are best positioned to discuss the report content, but just to orient folks who may or may not be familiar with our work, here's just a little bit about the National Academies. The National Academies of Sciences, Engineering, and Medicine are a nonprofit, non-governmental organization chartered by Congress in the mid-1800s to provide independent, evidence-based advice on some of the most pressing challenges facing the nation and our world. Sponsors, typically Congress or a federal agency, ask us to explore a topic of interest and produce one of several types of publications depending on their needs. Many times this takes the form of a consensus study report, in which a committee of experts assembles for 12 to 18 months to explore the published evidence, gather relevant data, and judge with their collective expertise to answer the questions at hand. The findings, conclusions, and recommendations of the committee are then published. These publications are often widely impactful, being used to inform matters of scientific and public interest, such as ranging from NASA's decadal science strategy to the availability of over-the-counter hearing aids to most presently and relevantly the VA's mid-2000s decision to designate ALS as a service-related disease. And so in this case, Congress asked NINDS to sponsor an Academy study identifying and recommending key actions for the public, private, and nonprofit sectors to make ALS a livable disease within a decade. As you can see in that list of subtopics there on the right, this was a very broad statement of task that primarily asked the committee to take a systems-level approach to improving care, research, and quality of life for people with ALS and their caregivers. How can we make care more impactful and available to people with ALS? How can we build on current Act for ALS initiatives? How can we ensure that as the ALS research agenda develops, a robust scientific infrastructure is in place to help researchers cure and prevent ALS? To meet this task, we assembled a wonderful committee of 18 experts in ALS care and research, people with lived experience in ALS, as well as experts in the specific services and the broad systems that impact people with ALS. Health law, palliative care, respiratory care, healthcare payment, health equity, things like that. And this group met over a year and a half in a variety of settings, and the report that they produced went through a very rigorous internal and peer review process, the final product of which can be found on the National Academy's website, and I'll be putting the link in the chat in a little bit just so everyone can see. But we have some slides on the specific content of the report as well, but I think for now I'll just pass it over to Rita and Mindy to kind of talk about their perspectives as very, very helpful members of this committee.
Mindy, do you want to get started on this?
Sure, that would be fine. I think I know everybody here, but I should thank Lyle for all this great information. Thank you for sharing with us. And for those of you who don't know me, I am Mindy Uhrlaub. I am a carrier of C9orf72. I lost my mother and my grandfather to ALS, and my children are at risk of inheriting the gene that causes the diseases ALS and FTD. I think that, the best way for me to describe my experience on this committee was, I was stunned, first of all, to be to even be nominated. I know that I have a unique viewpoint as a person at risk of ALS, to educate and to advocate. But I guess I Am ALS nominated me, and I still don't know who at I Am ALS did the nominating, but I'm sure glad that they did. I really felt like I needed to be there. That does not mean that I necessarily felt like I needed to be a doctor to be there. But it also, it was daunting, actually, the first time I went to meet with everybody. I was in a new city. I had never really been to DC before. This was going to be a new experience. I'm a lay person. And I didn't even own like a suit. So for me, dressing up for a meeting meant like wearing jeans that didn't have holes in them. And I really felt like I had sort of imposter syndrome. I don't have any like little letters after my name or anything. And so I was just very sort of starstruck when I got there. But I did come to the meeting with an agenda. And I feel like of all of the 18 of us, that I was probably one of the only people there who actually really had an agenda. A lot of the people just arrived to impart wisdom and to work as a team. But like, I had, I've always said that I had three major things that I wanted to get out there, in the world, that I felt like people should have genetic testing if they were ALS patients, that their families should have genetic testing, and that they should have genetic counseling. I felt that they should be enrolled in clinical drug trials, even while they're pre-symptomatic. And I felt like where it was appropriate, that there should be access to care and access to FDA approved ALS drugs for pre-symptomatic patients. That's a tough sell for a lot of people who are researchers and who are doctors and who have studied ALS and FTD for a long time. So, I kind of went into this with a, try and listen, try and compromise, try not to control viewpoint. And that meant I had to play nice, and I had to listen to things that I was not an expert on. And it also meant that if I wanted the genetic community to be part of the conversation, that I would have to really volunteer for every ad hoc committee that was coming together. I even joined a committee that helped define the word livability, because for genetic carriers, livability means different things than for somebody who's already a patient. I think that a lot of the people on the committee did not understand what the trauma is when you're a genetic carrier. That we've seen generations of people die of ALS, and that it's traumatic, and that we might have passed something on to our children is also traumatic. So I think that I was heard, I was listened to, and I felt that I was respected, and that my viewpoint was understood. That said, I got deep into the weeds on stuff. Like I talked about neuroprotective diets. I talked about whether or not FTD should be mentioned in this report. And, sometimes there was disagreement about that kind of thing on the committee. Sometimes we sort of had to talk offline about this. I brought up whether TDP43 was a pertinent biomarker. We discussed why genetic carriers don't enroll in research, or why they do enroll in research. And so, that it's tricky. It's tricky to navigate, but it was really like a deeply fulfilling experience for me. We heard from lots and lots of community members, including people who are on this call. We heard from peer reviewers, and, we discussed genetics, and, I felt like that, after feeling that I was like needing to go in there fighting for things, I really felt like we were all kind of on the same team, and that even the community members who came to talk to us were, thought that this was going to be a group effort. I was also aware that every aspect of this report, whether it be non-invasive ventilation, palliative care, the hub and spoke model, that was all really pertinent. I made friends with doctors. I learned how to control my temper, which is kind of amazing. I made a name for myself by the end of 18 months. Like, I feel like we all kind of like know each other, which is kind of an amazing experience. There are things that are coming up on the horizon for the report that I'm excited about. The ALS Nexus presentation is coming up, and the National Academy of Science, Engineering, and Medicine will be there to discuss the report. Jean will also be there to discuss genetics at that presentation. And going forward, I welcome any opportunity that I have to present this sort of genetic portion of the report to Congress or anybody else. I'm looking forward to seeing some of our suggestions being accepted by the community at large. And like, I will always make myself available to be a spokesperson for the genetic ALS and FTD community. That said, for those of you who are fellow and the legacy members, I can't really do this alone because I can't be everywhere all at once. And so, I obviously need your help. Please say yes whenever you're asked to participate in something like this. If the government comes to you and says, hey, we need somebody to talk about genetics, say yes, because our voices need to be heard. And so that's really what I have. I'm gonna pass it on to Dr. Sattler because she has to go in about 20 minutes, and she was an amazing member of the committee. And so I'll just introduce Rita and take it away.
Thank you, Mindy. Thank you. And thanks for giving me the opportunity to be here with you today and to be with Lyle to really provide you opportunities for all of the individuals that are on the call to ask us questions about this report. And I really want to say thank you to Mindy for being such a brave individual to join this team. This can be quite intimidating. I can only imagine what it feels like to be in a group of individuals that, as she says, have the little letters behind their name, which really don't mean that much. It just means that we just didn't know what we wanted to do, and we decided to just keep going back to school and keep adding things to it because we really just didn't know what else to do. No, but it was really an incredible opportunity for me to be part of this, because I don't talk enough about ALS and FTD in my day job, but because I had an opportunity to meet individuals that I would otherwise really not meet. Individuals that focus on specific aspects and areas that affect individuals that have ALS or that are affected by this disease, family members, and genetic mutation carriers. I learned more about how important it is to do respiratory care and that we have to intervene very early on. All of these things that I sort of knew, but really didn't know. And so it was for me, I think, equally eye-opening to be part of this committee than it was for Mindy. There is no doubt that I learned probably just as much as she learned by being together with this committee. But I also have to say that the fact that we had ALS patients, individuals that have ALS that are currently exhibiting the disease symptoms, in addition to individuals like Mindy that are genetic mutation carriers on that committee, was a life-changing experience, I think, for all of us. And by all of us, I mean the clinicians and the scientists that were in the group. Because without people like Mindy, we would have probably left out a lot of things in this report. She stood up bravely and raised her voice and said, but we have not talked about this or that. This is important, and the community wants to know and hear about this. And so we took a step back and we said, okay, how are we going to add this content into the report? Where does it fit best? How do we make it happen? And that was an incredible aspect that we would have otherwise not have had. So I applaud Mindy for being there, and the other patients that were there that contributed really so much that we otherwise would not have thought about, because you never, unless you live that life, you just don't know what aspects are important to this and what does it mean to make ALS a livable disease. I can think about what this means, but I'm not living this life and I'm not living that situation. So it's really the only people that can tell us what this means are the people that are affected by this disease. So it was, I really, really just echo what Mindy said. It was an incredible experience. The National Academies staff, including Lyle, were really tasked by keeping us on track with this, and they did a tremendous job doing so. And I think we put together a really important report that speaks to a lot of aspects that are relevant for anybody who is affected by ALS and by FTD. Is it perfect? Probably not. There's so much more that we would have liked to add, and we had to take out things because we felt that we're overwhelming the report. Could we write 10 more reports? I think yes, because there were so many things that we discussed as a group in the wonderful meetings that we had, either in person or via Zoom. Endless discussions about what is important, what should be added, where do we set the priorities. That was probably the most difficult part, to figure out what is really the priority and where should we focus on, to not distract from the other things that we also want to bring the attention to and that people should learn about and should think about. So it was a challenge over the last year, an incredible challenge, but a really eye-opening challenge for me. And I agree with Mindy that the opportunities now for us to speak to not just individuals that are affected by ALS and FTD, but also to our fellow clinicians and scientists, to let them know about this report, because I know that not all of them have read it yet, and that's why we go out and we speak at scientific conferences like the ALS conference that's coming up in Dallas, but also the Motor Neuron Disease Conference that's happening at the end of the year in Montreal, the NEALS consortium meeting that's happening in October. We will not let go, and we will inform not just individuals that are affected by these diseases, but also the clinicians and the scientists that didn't take the time to read this report, the nonprofit organizations that really need to be informed about this, the NIH that needs to read what we asked them to do, the different players that we felt are really important to address some of the concerns and some of the recommendations that we put forward. Insurance companies, they need to listen. They need to listen that ALS and FTD are very different than other diseases, and they have to change the way that they deal with individuals that need help and that need payments for care and treatment and anything else that is required to make this a livable disease. So all of these main players hopefully read this report. And if not, we'll make sure that we point it out to them over the next few months, so they do have to read it and that they make the changes that we recommend for them to do. Again, is this report perfect? No, it's not perfect. But I think we did a pretty darn good job in putting together recommendations that are incredibly important. And if the players that we address in this report live up to their potential, I think we make a really big impact on this disease, on both of these diseases, because I'm with Mindy. I was always fighting with her that we make sure that FTD gets included in this, because there is no ALS without FTD and the other way around. So I'm happy to take any questions from anybody in the audience, just about how we felt during this meeting, whether what I would like to add to the report, what you want us to add to the report. So if we write a second report, then we make sure that we add all of the things that you felt were missing from this report, or we bring it up when we talk about it in public, and that way we have another avenue to address your concerns as well.
Wow, amazing. Thank you so much for your great efforts, Dr. Sattler, Mindy, Lyle, thank you all for the hard work you did, but a huge cheers to Mindy for stepping up for our community and wearing her heart on her sleeve in tense conversations where, you know, that there's not enough for people living with a diagnosis of ALS today. And us bringing up things that are on top of that can be a very hard thing to figure out, because it's not like we have everything solved, of course, for people diagnosed with ALS today, but we still exist. And Mindy, thank you so much. And we all appreciate you and your leadership. So before we get into anything, just wanted to say that out loud. So if folks have a question, if you want to raise your hand, I'll call on you, or you can put it in the chat and we'll read it out. But as we get those in, or comments, as we get those in, I just wanted to raise that in the summary for the genetic carriers, and I was just wondering for Dr. Sattler or Mindy, if you guys either had thoughts on this, that there was contemplation of research participation and there was contemplation of genetic testing and counseling, but that seemed to be the only contemplation of the needs of the at-risk community. So was there discussion about the period in a person with great risk for life in between finding out they have a gene and they are diagnosed with ALS, you know, that period in between, because research is not, you know, care. Research is a voluntary, altruistic endeavor. So just curious if that time period in our lives was up for discussion as a priority to figure out.
Yeah, I'm going to let Mindy add to this, but I think we did, and I hope she agrees. We had really long discussions, I think, about this. Interesting discussions, painful discussions, how we really best go about this in-between. I love how you phrase it, Jean, because it is sort of this in-between phase that's, you know, almost like, you know, the gap between, okay, we're getting diagnosed and we're ready to be part of clinical trials and all that. And how are we going to take advantage of this? And I think that's where, if I would have to write another report, then that is where a lot of the gaps are still there, that we just don't know yet how to really best handle this. I've been writing a grant over the last week or two, and I had Mindy and you guys actually in my mind quite frequently when I wrote this report, or this grant, I should say, because I felt so much that I learned from Mindy and your community at a whole makes it into my grant applications, because I realized that there's really gaps that we have missed as researchers. I'm not a clinician. I'm a basic bench scientist. Obviously, I work in translational research because I want to take what we discover on the bench into the clinic as quickly as possible. But I think we've overlooked some of these, what I call the preclinical phase of individuals that are affected by these diseases. When we know they have a genetic mutation, they don't show the clinical symptoms yet, but we know that they're cellularly and molecularly affected by this. And how are we going to go about this? How do we group these individuals? How do we assess them? Obviously, biomarkers. We all, you know, live and breathe biomarkers these days, because that is one way that we can figure out that there are cellular and molecular changes happening before you start dropping your coffee mug, or before you start dripping, or before you start having cognitive changes. But how do we assess this, right? We cannot poke a hole in your brain and take a piece of your brain. We would love to, but we can't. So how do we really figure out what's going wrong, and what are the best ways and the most reliable and the most informative ways for us to figure this out? And we had these discussions. And I agree with you that not enough of those discussions made it into the report. And I'm probably going to be the one who admits that the reason they didn't, because we don't have a good solution to it yet. But I say yet, because I think we will, because a lot more attention is being given to this. But Mindy, I want you to speak to this.
Well, yeah, and I mean, I am in agreement with you, Rita. I definitely remember having conversations about TDP 43 and like people, throwing water balloons across the room at each other or whatever you call it. We were, we all got along very well, and we were all very well behaved, but like the things when they got heated, they were on things like this, like, is TDP a good biomarker for people with C9? Is it a good biomarker for people with SOD1? And then we would have to go through all the different genetic variants and whether, what's the best biomarker. And, but, it is true that when we're talking, earlier in the report, and we could bring up the slides if we need to, but there were conversations around palliative care for people with ALS and psychological care for caregivers. And, the truth is that does not necessarily, that net does not hold people who were not people who are not caregivers, but are gene carriers. And there are definitely holes in the report, because we could not come to consensus on various things like biomarkers and what do we consider to be adequate counseling for people with when it comes to genetic counseling. So what's adequate psychological care when it comes to genetic counseling? So yeah, I agree with you that we could not be every single thing to every single person with the report. And this was one of the major shortcomings. And I think that it would be wonderful if we could write another report on ALS biomarkers. Like I love that idea, and how to include pre-manifest genetic carriers. Like I would love to do that.
Well, we're approaching the half hour. Dr. Sattler, do you need to jump right at it? So feel free. Paul has a question. Paul, please go ahead. Dr. Sattler, if you need to jump, feel free also.
Yep.
Hi, everybody. I'm on the road, so I hope you can hear me okay.
Yes.
I think this report is landmark in a lot of ways. Nothing is going to have everything, but you guys did a really good job of laying the groundwork for what could be a major campaign to kill this disease. And I thank you. I participated as a person with ALS. And my hopes were not high. But you guys surprised me. So very glad that this report is out. I am extremely at the overall goal of making this disease livable within 10 years. There's way too much happy talk in this community, and not enough hard-nosed, matter of fact, goal setting that's going to get us down the road. Now, that said, livable is not 2 to 5 years of life expectancy. Livable is maybe 15 to 20. And we're nowhere near that. So I want to raise one issue that's going to make or break this report and this goal. That is funding. If we don't get the funding we need to implement the goals and ideas of this report, and we wake up in 10 years, those of us who are left, and this is still 2 to 5 years, trust me, Congress is going to be pissed, and we ought to be very pissed. So I just want to put as sharp a point on that as I can. We are talking about billions of dollars over the next 10 years. Billions, probably 10 to 15 billion to make this report a reality. That's going to be a fight. And it's a fight worth having. So, thank you for that report. It's audacious. It's ambitious. Now we have to go out and get the money to make it reality. Thank you.
Thank you so much, Paul. And, oh, sorry, go ahead. And Paul, I know not only are you fighting for yourself, but for your family, since the genetic component is implicated in your family. And we appreciate your passion so much. Mindy, I just wanted to read out some things in the chat that Alyssa is beyond thankful for this. This is amazing. Thank you, Mindy. Rod said, we are all so grateful. And he put a little brain. Someone else said that they were struck by seeing genetic carriers represented so well, and to thank you, Mindy, for working on this. So lots of support for you, Mindy, out there. And thank you so much, Dr. Sattler. I know you got to go. Is there any other questions or comments for Mindy or Lyle?
You know, actually, if we're waiting for questions and comments, I'm assuming there are people who have not read the entire report because it is a big report. Lyle, do you want to share your screen and show us some of the chapters, and maybe that'll get some questions going?
Sure. Yes, I will share my screen. Let's see. And can we all see this? Oh, sorry, yeah. I need to present it. So again, I as staff and not a committee member, I can't speak specifically to the arguments and content in the report, but I'll be happy to give just a summary of what is in each chapter, just to kind of point everyone to maybe some topics of interest that they might have, places they might want to read, things like that. So in chapter 1, the committee really just kind of outlines what, the context in which the report lies, both literally the statement of task that Congress and NINDS provide to us, as well as kind of the committee's scope, as well as just kind of like the literal clinical and scientific background that's necessary to kind of delve into these issues. In the clinical nature of ALS, we talk about things like symptoms, the epidemiology of ALS, risk factors, development, natural history, and heterogeneity, differences between different subtypes of ALS, as well as diagnosis and treatment. And in terms of the study process, chapter 1 lays out the statement of task. It notes that while this is separate and not part of the funding in Act for ALS, it certainly is a companion piece to those efforts and lies in the context of not only the Act for ALS funded efforts, the public-private partnerships, these strategic plans from FDA and NIH, but also all of the other major ALS initiatives that are happening in the scientific and the philanthropic worlds today. But also the committee discussed how they went about including the lived experience of ALS in the report. The committee included people with ALS. It included people with who are genetic carriers, included Mindy, of course, on the report on the committee. We also had a panel of about, I think, a half dozen lived experience consultants who read select pieces of the report. We also had numerous information gathering sessions, one of which was at the beginning, just kind of a scoping kind of lay of the land type meeting where representatives from various nonprofits related to and directly in ALS kind of came to share their perspectives with the members of the committee. And then later on, about halfway through the process, we had a larger public workshop focused. We had three different sessions on 3 different days focused on research, on access to care, and on the lived experience of ALS. And those were all super helpful to the committee. In chapter 2, the committee talks about what it means to live with ALS today. They advance a definition of livable that is mostly along kind of two large categories. First, increasing the effectiveness of treatment with the hopes of abating symptoms and finding a cure, as well as quality of life for people with ALS. Both of these 2 things, according to the committee, were they were important. They were both necessary to a core definition of livability, but neither one was sufficient on their own because priorities are so unique to each person. Everyone conceives of livability a different way. The committee then discusses in chapter 2 various challenges to improving livability. Many of these are discussed in later chapters, as we'll see in more depth. But it kind of lays out the main challenges that the committee wanted to grapple with. And also throughout this chapter and a few of the next ones, there's perspectives, direct quotes from people with the disease, from caregivers, from genetic carriers of ALS. In chapter 3, the committee talks about making ALS livable in the near term. Issues of interest here are insurance and payment, caregiver challenges and supports, various subspecialties that are super relevant to that we already know works, that we already see in the literature has benefits for people with ALS, things like palliative care, respiratory care. And it also outlines a number of recommendations that are more short-term goals for various stakeholders in these areas. Things like payment and reimbursement to make care more accessible and affordable, with the role of nonprofits to help connect people to resources, both those that are funded by these insurers, as well as resources that might be a little bit harder to maintain or to get, those that are more community-based in nature, things like that, as well as caregiver needs and respiratory device access. In chapter 4, the committee advances a new and I think bold model to create a sustainable and accessible ALS clinical care and research system. Based around current models of multidisciplinary care, and the report discusses the literature and evidence around that and benefits, as well as parallels in the VA care system, before then recommending that NIH builds on already existing clinical care models from ALSA and from MDA to create a hub and spoke clinical model based around larger academic medical centers serving as hubs, and more community-based and regional-based clinics serving as various spokes. This is modeled after similar systems in cancer and stroke that are overseen by NIH. And kind of building around this, the committee then recommends ways to improve racial, ethnic, and geographic equality, ways to align reimbursement policies to make this system of care more sustainable and to incentivize new clinics to enter the system to increase geographic coverage, as well as kind of making parallels in the VA system of care and embedding research throughout all of this, making research and enrollment in the registry, things like that, a routine part of ALS care, as opposed to something that only some people enroll in. The next chapter discusses advancing ALS research and accelerating therapeutic development. There's a historical discussion of ALS drug development over the years, things that exist now and were recently started, both in ACT for ALS, as well as, you know, some of these other initiatives. And the committee really wanted to build around what already exists, kind of not necessarily, you know, quarrel with or redirect, you know, redefine scientific agendas, but really just to kind of make a research system for an evolving research portfolio as the science advances. How can we make sure that scientists have the tools and the infrastructure that they need to develop cure, to develop prevention techniques, to abate symptoms, things like that. There's a discussion of biomarkers and endpoints, as well as kind of trade-offs in the processes of how you develop these pharmaceuticals. The recommendations, as I mentioned, are more system-based in nature, but there is a little bit on kind of things to add to current research agendas. Again, the list may or may not be exhaustive, as you know, Dr. Sattler said, but it's of course just you know, based on what evidence already exists, kind of early research. And in chapter 6, perhaps most presently, there's a discussion on preventing ALS. As was already said, the two kind of the main thrusts of this chapter were around genetic testing and counseling, as well as, you know, greater research participation. You know, there's a discussion in this chapter of various risk factors, both genetic and non-genetic, as well as a discussion of what already exists in the literature. I know Rita mentioned earlier that in some areas there wasn't a whole lot, but the committee was able to write a bit about what we know about these various risk factors and kind of the implications of that on prevention. The recommendations here are, again, increased access to genetic testing and counseling without fear of genetic discrimination, some of which is still not covered by the federal GINA law, the Genetic Information Non-Discrimination Act. It's not covered because there are certain insurance areas of insurance that are only covered at the state level. There's also a recommendation on funding prevention research. Again, the report, I think, is very clear about what is and isn't known already in the evidence base, and in order to develop the evidence that might be needed for greater scientific consensus on these issues, what good prevention looks like, what, you know, how to deal with this kind of in-between area, things like that. What are these unique unmet needs by your community? There just isn't currently a lot in the literature. There's a lot of things that, you know, kind of intuitively and, you know, based on it and experientially, we, and especially you, might know, but just kind of figuring out what that means and what that looks like specifically in a scientific manner is something that the report recommends. And there, in other chapters, there's some mention of including people with people at higher risk of ALS in various research initiatives, including the National ALS Registry. And sorry, I know I said I was going to put the link for the report in the chat. I guess it slipped my mind because of this wonderful discussion we've been having. But it's the link is here, nationalacademies.org/living-with-ALS, and that will go in the chat this time once I'm done talking, I promise. And there's a bunch of resources there for the advocacy community, for various stakeholders, not just the report, but as you can see in that list, there's a lot of different resources for different populations. As Mindy said, the committee, a few members of the committee are going to be presenting to ALSO's ALS Nexus conference just next week. I hope you can join for that discussion. It's going to be, I think, another great opportunity to get this report out there in the world.
Thank you so much for that whistle-stop tour of the report, Lyle. There was a lot to get through, so we appreciate that. And of course, a lot of hard work went into it. So thank you again, Mindy. Hearing that, any other reflections or questions from the from folks?
So Gene,
Yeah, go right ahead.
So I'm sure that there's a finite number of dollars available for research into diseases. So how many other programs is this program competing with to get the attention of researchers, the government, etc.?
Well, when you're saying this program, are you talking about the National Academy or the
No, I
report?
mean, well, if it's whoever doles out the money, there are other diseases other than ALS.
Yes, no, actually, you have a very good point about that, David. There's a question that we can be good advocates on is right now dementia work is funded more generously by the NIH than the any other disease area. There's like money set aside for dementia research, and ALS does get some of that because of the connection to FTD, but it could be more explicit. So that is something there. And there's also the fact that TDP43 could be the linchpin on all this. We don't know exactly yet, but it's implicated in Alzheimer's as well as ALS and FTD. And Paul, go ahead.
Just very quickly. At NIH, the total budget is about $50 billion. ALS all in gets about 130 billion of that. So the answer to your question is, to put it fairly bluntly, we're getting our asses kicked by other diseases. Okay? That's why I keep raising that issue.
Great, definitely very good points to dwell on and to consider from both Paul and David. Are there any other topics that folks want to dive in, or any other nuances on the shared disease resources that could be marshaled for this?
Sorry, I'm
Mindy.
literally just looking at the chat and remembering not only to thank Paul, but also to thank Michael and you, Jean, for participating in peer review and peer engagement for the report. I mean, we couldn't have done it without you, so that was great.
Well, and Mindy, I know you, I'm sure we're helping to get our names in for that. So cheers again. There's a couple of questions in the chat, so I'll just read those out for you, Mindy. Was family planning for people at risk discussed?
Actually, I believe Jean might have brought something like that up when she was talking about the cost of ALS and how much it actually costs to participate in family planning when you are a genetic carrier. I definitely remember we heard from you there. I can't remember. I can't remember if we talked about family planning when it came to genetic counseling, because I think that the idea was that you can't, it was kind of a non-starter. The family planning part was kind of a non-starter without the genetic counseling and genetic testing first. So it was kind of a cart before the horse situation. But to me, that's just kind of I think that's the next report, isn't it, Lyle? How do genetic carriers plan for having babies?
Excellent point, Kelsey. Thank you for sharing that. Also, Cassandra asked, how do we hold people accountable? Insurers, Congress, etc. Mindy, thoughts?
You know, I am not an expert on insurance, so I'm going to respectfully back away slowly from this particular issue. You know, and for me, like, I would love to talk to Congress about this. I would be the first person to like barge into the, you know, barge in and talk to them about genetics. But I need to be asked by the National Academy to do that first. But yeah, I mean, holding Congress accountable, these are not my areas of specialization. I would have to get other committee members to actually comment on these things. Jean, you're a union organizer, you're a former union organizer, you probably know the answer.
Well, certainly what we're doing with End the Legacy, just keeping on, organizing, getting organized, developing a movement is how we're gonna be the change we want to see in the world. Well, we're almost at the hour. Mindy, do you have any like final thoughts as we move towards the close? And we'll still take some questions if they come in, but
Yeah, I mean, to be honest with you, like, when the report came out, I was actually a little sad. Like, I was actually a little sad that it was over. And I don't know if that speaks to the teamwork that went into making this report. Or if it was just like being in the room with so many big brains. I mean, not that I'm not in a room with big brains here on these Zooms, but like physically in the room with all these people who, you know, there were like, including the staff, you know, there were sometimes 25 people in the room and they were all trying to get to the same answer, which is how to cure this thing, how to make it easier for people who are suffering with it and family members of people who are suffering with it. And the fact that is not, the fact we're not meeting on a regular basis now actually makes me feel a little sad. So, you know, it speaks to how exciting it is to work with others on this, and this idea of collaboration to end a terrible disease and to make it easier for other people. I just, you know, I hope that everyone will get involved in something like this if they can. If they have the opportunity, they should. I think that it feels like we don't have any agency over diseases like FTD or ALS. And advocacy like this gives us agency. So that would be my final thought on it. And I just have to thank Lyle and the staff at the National Academy for allowing me to even participate.
well, what a wonderful note to end on. So I appreciate everybody for coming, and the recording will be posted to YouTube. Mindy, again, you see it in the chat, you see it in all the hearts and other emojis coming up during this talk. We all appreciate you so much. And thank you, Lyle, and your whole team. I hope everybody has a great day. Bye-bye.
Thanks, Lyle. Thank you, Jean. Thank you, everybody, for showing up.
Thank you all.